I'm Bob Schrupp, physical therapist.
Scott Bossman, physical therapist.
Brad Heineck, physical
Look
therapist.
how he pauses like that to draw attention to him. Together, we are the most famous physical therapists on the internet,
In our opinion.
in our opinion. And as you might have noticed, this is the second video that Scott has now joined us in. And Scott, there's just one thing, you know, if you're going to want to be a part of us, you're going to have to get a Jerry Garcia tag.
Garcia.
Oh, is that what it is?
Yeah,
Okay.
we forgot to tell him that.
Yeah, you did
forget
forget
to
to
tell
on
him about
purpose.
it, so.
So what's on the drawing board today?
Joint stiffness and pain,
Yeah.
and how to prevent it.
Which joints?
We're going to talk about the joints of the arm, the upper extremity.
Okay.
Shoulder, elbow, wrist.
Shoulder, elbow, wrist.
Okay.
So in one of our previous videos, we talked about the healthiness of joints and how that's often overlooked when we talk about healthiness of our body, and how when we do some stretches, sometimes we'll do stretches and it won't get to the joint that we're talking about. As we're getting older, what will happen is we will get stiff joints, and that will lead to pain and eventually arthritis down the road. So the more mobile your joint, the more normally functioning the joint is, and obviously the less pain that you'll have.
So you're saying you can be flexible in the muscle and flexible in the joint? It's two different
Exactly,
components.
it's two different components. You can have muscle flexibility, but then you also have joint flexibility, or what we call joint mobility. And we're going to talk today about some of the common losses of joint mobility in the arm.
Okay.
So one of the things that we start to lose over time, we'll start with the shoulder.
Scott, before you mention, do you just want to mention the synovial fluid?
Oh yeah, you bet. So let's
This
talk
is
about
a
the-
model of the shoulder, by the way.
Yeah.
You know, can you
It's,
zoom in on
it's
that a
the
little
right
bit?
shoulder,
collarbone.
so it'd be
There you
like
go.
this.
So,
You'd be good.
here's the collarbone, and actually this is the scapula, okay, or the shoulder blade.
Shoulder
Yeah.
blade back
It's
here.
right back in here, so,
That's how it fits on.
yeah, and then here's the humerus, obviously cut off. But if we could pull that out of
Right.
Scott's arm, there we go.
All right,
It's like
and then
Superman.
when we're talking about a joint in the arm, it's called a synovial joint. There's the term synovial up there on the board for you spelling aficionados, synovial. And what synovial joint means is that this joint is encapsulated, or it's surrounded by what we call a capsule, okay?
And I think in this case, you almost can see a lot of the capsule, can't you?
Yeah.
That's much of
Yeah, the capsule is
material.
created by ligaments and connective tissue.
And in this case, you always hear about the rotator cuff, and you know, that's part of the capsule of the shoulder.
Right, that's the rotator cuff right there. A normal, healthy synovial joint is one that is fully flexible. And when you have normal flexibility in the joint, and when it's moving normally, synovial fluid is produced at a normal rate, and that lubricates your joint. So it's just like the oil in your car or in your bearings.
Sure. Actually, am I on camera?
Get in here, Bob.
Well, when I was at Mayo, when I went to school there, they actually did a study on little rabbits that had arthritis. And half of the rabbits they put in a little knee immobilizer, this is their knee joint,
Sure.
and the other half they moved it on a little machine. And of course, which joint was more healthy? The one that kept moving. You think a joint, like an arthritic joint, would actually feel better if it was immobilized, but it actually doesn't. It actually gets worse because there's no synovial fluid being produced.
Right.
Or added, and therefore there's more friction, and therefore it breaks down quicker.
Right, exactly. A stiff joint does not produce the fluid, which leads to degradation of that joint. So we want to talk about how to maintain...
Degradation, that's a good one.
Degradation, you like
Or
that one?
falling apart.
Yeah. We want to talk about how you maintain normal joint mobility in your shoulder and your elbow and your wrist today.
Okay.
All right, let's get it going.
All right, so one of the things that is common as we get older is we start to lose what we call shoulder internal rotation. So Brad, turn around here for me. Some of you may notice that on one side, you're able to reach nice and high.
Scratch your back
Yeah,
there.
and scratch your back or towel off, and on the other side, you're kind of stuck and it won't go as high.
Brad
So,
has trouble taking his bra off.
Hurts right there.
right. So Brad's losing some joint motion there and is not able to rotate as far as he can. Believe it or not, a loss of motion this direction can actually affect your motion in other directions. So he might not be able to go as high this way or reach this way as well either. So if you're noticing that, we'd encourage you to try this stretch here. What you can do is take a belt or a towel. You're going to drape it over. So Brad, bring this hand here, hold on to the end of the belt. And then if you can turn sideways so they can see you're holding on to the
Sure, right
front of the
here.
belt here.
Yep.
I think you'll do better actually if it's over your other
Yeah,
shoulder.
that's right.
There we
that's
go.
right.
Okay,
Yeah,
now
okay.
turn back around. Now what Brad's gonna do is he's gonna pull down with his left arm, let this arm relax. You're just gonna go up until you
Use the
feel,
black belt.
oh, black belt,
This
yeah.
blue shirt.
Actually, this works better. You can just take one right out of the closet. I always like to
Yeah,
just do this so that you don't have to hold on tight. You can relax that arm a little bit better.
And a dress belt is nice and slippery.
And it looks better.
Yeah, there we go.
Okay. Now, this is the hard part. Sometimes you need a second person. I'm gonna go over here. Yeah, this is
Yeah, that's
bad.
nice, look at that.
Wow.
Yeah. So
There's not
I'm
any friction there.
pulling
All right.
down here, we get the reciprocal action on the back
Yeah,
side.
no friction.
All
And I'm
right.
gonna go up, how far, Scott?
Just till you feel mild pressure or mild discomfort.
So don't go to that no pain, no gain. That's
Exactly.
not-
No pain, no gain does not apply here. If you have osteoarthritis or severe arthritis in your shoulders, I would not do this until you consult your physical therapist. But if you're feeling joint stiffness, maybe some mild discomfort, and you're noticing a loss of range of motion here, I think it's safe to go ahead and try this.
And how many repetitions?
About 10 or 15
And
repetitions.
should I hold it up there for a while, or?
Well, you should go up, hold for a few seconds, and come back down. And then if it feels like it's loosening up or getting better, with each repetition, you want to try to maybe go up a little bit higher.
Sure.
Okay? So if it's loosening up, loosening up, loosening up, go ahead and go a little higher, as long as it's not producing pain.
Just to again re-emphasize, if you have bone thinning, you want to be a little careful with this. I mean,
Right.
we don't want to break anything.
What's the
so.
other term for bone thinning?
Osteoporosis or
Osteoporosis.
I don't know if osteopenia, if that would be as big a concern, but I guess in either case, you're gonna wanna be careful.
Right.
So,
And after you're done with this, how should it feel? If I do 10 or 15 repetitions, I'm done, feel good? Should it feel sore for a day or two? Or?
No, it should feel good. I mean, if you have some discomfort for 5 or 10 minutes, you know, you feel like you did something in that shoulder, but that discomfort goes away, that's okay. But you should not have any
Sharp pains or
discomfort.
anything like that?
You would refrain from doing this type
Yeah,
of stretch.
stop doing it.
Yep,
Okay.
exactly.
All right, thanks for the belt, Bob.
yeah.
So that's a way to restore
worse is
internal
balance.
rotation in the shoulder, and actually that may
Hey,
improve motion in other directions
Right.
as well.
Yeah, look at that, I can.
Yeah, a little better now?
Yeah.
Excellent. Let's talk about the elbow quick. So we live in this flexion dominant society where we sit too much, we do too much computer work, our elbows are bent, we drive, so my elbow is bent too much. As the years go on and we're spending too much time in this position, sometimes we'll lose elbow extension. Elbow's not able to straighten all the way, leads to a stiff joint, decreased production of this fluid, which is your natural body's lubricant, and eventually some pain as a result of that, which can lead to arthritis. So we want to maintain elbow extension, okay? An easy way to do that is to find a table, turn your hand this direction,
Palm up.
palm up, and then put that palm on the table. Now what you're going to do is you're going to take your other hand and just gently extend or straighten that elbow as far as you can, just till you feel a little pressure. It should not be painful.
Your elbow actually hyperextends, so someone else who has tightness in their elbow.
Well, let me show
they
mine.
may have to-
I actually have tightness.
Okay,
Yeah.
Bob's
Yeah.
a real McCoy. Let's get some of this.
That's hard to tell. Well, yeah, I guess that would be the way, huh?
Yep.
Well, it actually even hurts.
Now this would be a good example.
Yeah.
Bob should not cause discomfort or pain to himself.
So you can bump up against the pain, right? That's what
Right.
I always tell patients. You can just bump up against it, but get off of it right away.
Right.
So-
And what if they're just not that, someone in their 60s or 70s or
Like
have
this?
yeah, or they can't get their wrist to go back like
Right.
that? Is there an option to,
Because you do need good wrist extension, so an option for that would be just to straighten here and just to try to bend that back. The other option would be if you have a bolster
Right.
or something, you can sit down, yeah. Sit down, place the elbow over the bolster, and just let this extend. You can take your other hand and give some pressure in a downward direction to bring that elbow from a bent position to a straight position.
Now, I don't have a bolster, but you can just take a towel and roll it up and it acts as a bolster. And,
A coffee can or,
sure, something that's
something like
comfortable.
that.
There you
And I would
go.
think that you're gonna be prone to this, Brad, with all the tipping you do.
Why?
Okay.
Why,
Then we have one more on the shoulder we're gonna do?
oh yeah, that's
With a
right, we
cane?
forgot about
Or
that.
with a cane or a yardstick?
Alright, yeah, so another thing we lose with the shoulder is extension, okay, this direction of movement. And a way to regain that mobility is to take a cane or a yardstick, put it in the base, put it in the palm of your hand, push backwards, like so, till you feel mild stretch, mild discomfort.
Usually right up in here.
Yep, might even feel it down in here a little bit.
So it's going behind you, not off to the
Right,
side.
not out to the side this way, but directly behind.
I always tell patients to think that there's a, pretend imaginary wall right here, you're going right alongside that
Yep.
wall.
Very good. All right, that covers the upper extremity. Brad, is there anything else you wanna fix today?
Well, I'd like to try to learn how to fix a broken heart, Bob, but we're not that good at that yet, so we'll
That's
switch
good.
the
I
rest of
screwed
the
that up,
body.
didn't I? All right, thanks a lot.
Thank you.